A major shift could be coming in how Americans pay for fertility treatments.
As health reporter Haley Hernandez explains, the Trump administration is exploring ways to make IVF more affordable.
In this report from 2019, couple Kristen and Aaron Price explained the exhausting and expensive treatments they went through to try and have their family. IVF cost them thousands, and after the first round, the couple did not develop an embryo that could develop into a baby.
Yeah, it was a puddle on the floor for hours to go through all of that and then to have nothing.
Dr. Kaylin Silverberg from the Texas Fertility Center and chair of the Medical Advisory Board of Americans for IVF recently met with top Trump administration officials to discuss expanding access to fertility treatments.
He asked very specific, very in-depth questions about where are we today, what are options that I saw as to how we can get to what the president wants to achieve, which is expanded access for fertility treatment, including in vitro fertilization.
He says the administration is considering potential paths to coverage, including an executive order to extend coverage to federal employees, military personnel, and those on the Affordable Care Act. Dr. Silverberg says many insurance plans currently cover a diagnosis for his patients, but not treatment.
So substitute breast cancer for infertility. What do you think would happen if, God forbid, Susie Smith finds a lump in the shower, she goes to get a mammogram, she gets a biopsy, and she sat down and told that she has breast cancer? And then to make it worse, they say to her, well, I know your insurance has covered the diagnosis, but you don't have any treatment coverage, so best of luck to you.
Dr. Silverberg says now the White House could bring hope to thousands of Americans struggling to build their families.
One reason I chose infertility is because of the quality of the relationships that a fertility doctor develops with their patients. And we get to know them extraordinarily well, maybe too well sometimes, because we have too much insight into the suffering that they're going through.
And when it works, it's a relief for couples like Kristen and Aaron, who did eventually have a daughter.
I would do it 1,000 times over just to know her.
Dr. Silverberg says a lot of his patients have to give up before having a baby because the cost is too burdensome. Now he expects the Trump administration could announce initial plans for fertility coverage in the coming weeks. And for more on the breakdown of what that means for cost, I've got details on click2houston.com. I'm health reporter Haley Hernandez, KPRC 2 News.